We begin tonight with one man's story of surviving COVID-19 while receiving treatment at Parkview Regional Medical Center. Good evening, I'm Tara Brantley.
And I'm Dirk Rowley. The Fort Wayne man is one of two people who received a rare treatment that doctors believe saved his life when they started to run out of options. Wayne 15 Sierra Tufts spoke with him as he recovers at home.
43-year-old Ronnie Rutherford was on life support for 29 days following his positive COVID-19 diagnosis. Doctors say if it weren't for this rare treatment, we'd be telling a different story about Ronnie. At the end of March, Ronnie went to the hospital after experiencing a fever for multiple days in a row.
I walked inside and then they put me in a wheelchair. They checked my temperature, it was so high. And they started packing me with ice. And before I knew it, the next day, I just didn't know where I was at.
And that would be close to the last thing Ronnie remembers for nearly a month. It would take 6 days before Ronnie got his positive COVID-19 test results due to lab backups. His girlfriend, Sheila Fida, quarantined at home with their 3 kids, relied on updates from the hospital staff since she couldn't be at the hospital.
But they started treating him as if he did have COVID. And he did receive the Zithromax and the hydrochloroquine within a couple of days of being there. He was only on a regular floor for about a day and a half till he went to ICU. And then 2 or 3 hours into ICU, he went on life support.
Ronnie stayed on life support for 29 days.
We was being told that his chances were poor of surviving. Last resort, there was nothing else they could do for him at that time,
Except being placed on extracorporeal membrane oxygenation, or ECMO.
So what it does is there is a pipe that takes blood from patient. That blood goes through that membrane, and in that membrane the carbon dioxide gets exchanged and oxygen gets exchanged, and the blood kind of goes back to the patient.
ECMO is set up outside the patient's room and requires a dedicated nurse to monitor the machine, making it a very labor-intensive treatment. He spent 13 days on that machine. Sheila and Ronnie believe he wouldn't be here today if it weren't for ECMO. Sheila also thanks all the nurses that checked in with her daily and video called with her so she and the kids could see Ronnie while he was still in the ICU.
Not only were they doing the hands-on work for the patients, but trying to comfort us from afar since we couldn't be there, and just kind of assure us that they're trying to comfort him as well at the same time since we couldn't be there.
Ronnie's been at home on the mend for a little over 2 weeks now. He says he can move a lot better and is receiving physical therapy. Sierra Tufts, Wayne 15 News.